Welcome to today's Explainer. We're jumping right into a massive strategic pivot from a global healthcare giant. We're unpacking a breaking story from the Economic Times about Roche, one of the world's most established pharmaceutical companies, planting a huge digital flag in India. So let's look at not just what they're doing, but exactly why this is an absolute seismic shift for global healthcare.
Now, to really grasp the gravity of this, we have to ask ourselves a pretty fundamental question. What actually happens when traditional biology collides with modern code? Think about it. For over a century, pharma was driven entirely by physical science. But today, well, the boundaries are completely blurring. The next life-saving treatment might not actually be found in a petri dish. No, it might be uncovered within a massive data set by a powerful algorithm. And that intersection of healthcare and high tech, that's exactly where our story takes place today.
So, part one, pharma meets digital tech and the evolution of healthcare. Let's get into it.
Okay, so first off, what is a digital technology hub? It's essentially a corporation's centralized nervous system for modernization. Imagine a dedicated space where data scientists, engineers, and digital strategists all huddle up to build the platforms of tomorrow. For a legacy business like Roche, establishing one of these hubs is a huge, bold declaration. They're basically saying, hey, we're no longer just making a physical product. We are officially becoming a data and technology company. It's a massive shift.
Because historically, as we all know, pharma was incredibly physical, right, and highly manual. We're talking physical laboratories, pipettes, test tubes, and honestly, years of grueling trial and error. But the new paradigm is digital first. Instead of just testing chemical compounds on physical cells, this digital-first approach computationally simulates millions of interactions in just a fraction of the time. I mean, it's a fundamental leap. We're moving from purely physical experimentation to tapping into the immense power of digital prediction and analysis.
Which brings us to part two, Roche's Hyderabad announcement and breaking down the move itself.
So, the breaking news straight from the Economic Times is brief, but honestly, it is massive. Roche is officially setting up a brand new digital technology hub in Hyderabad. And to be clear, they aren't just opening up some small satellite office here. They're actively building out that digital-first reality we just talked about, and they've chosen to do it in one of the absolute most dynamic technological landscapes on the planet. To really understand the weight of this initiative, it comes down to three overlapping pillars. First, you've got the company itself. Roche, a legacy healthcare giant armed with vast resources and incredibly deep biological research. Second, you have the initiative, this digital technology hub, which represents a total pivot towards software-driven healthcare. And finally, the location, Hyderabad. It's this exact intersection of massive legacy resources, highly specialized tech, and specific geography that makes this strategic expansion so incredibly compelling.
Moving right along to part three, inside the tech hub, why Hyderabad?
You see, choosing Hyderabad is a highly calculated geographic move. Modern corporations naturally go where the talent is, sure. But more importantly, they look for strategic intersections. Hyderabad isn't just a software city. It has a really rich, deeply established history as a major pharmaceutical manufacturing and research hub. So by setting up shop right in this perfect Venn diagram of software engineers on one side and life science experts on the other, Roche immediately plugs into a pre-existing ecosystem. They are tapping into a workforce that already gets the unique, complex nature of healthcare data.
Housing this hub right in Hyderabad creates a completely vital bridge between traditional healthcare and cutting-edge tech. Roche is basically ensuring their tech talent isn't operating in a vacuum. Instead, their developers are physically surrounded by the very industry they are attempting to digitize. This creates a super accelerated feedback loop of innovation that, quite frankly, you just can't easily replicate anywhere else in the world. It's a brilliant setup.
All right, let's zoom out a bit for part four, the global impact. Because a single regional hub like this actually acts as a massive global catalyst. When a giant like Roche makes a move like this, the wake of it accelerates digital transformation across the entire healthcare apparatus. It pushes the boundaries of what predictive medicine can actually do. Plus, it sets an undeniable precedent for big pharma as a whole. You better believe competitors are watching this very closely. If they aren't actively fusing computer scientists and biologists side by side to translate biological problems into code, well, they risk being left entirely behind in this next era of medicine. Which leaves us with this final massive question to consider. As companies like Roche completely blur the line between tech and traditional medicine, who builds the next generation of healthcare breakthroughs? I mean, will the cure for the next global pandemic be discovered by a biochemist hunched over a microscope? or by a software engineer in Hyderabad running a brand new machine learning algorithm? Well, increasingly, the answer is both of them, working seamlessly in tandem. Thank you so much for joining me for this explainer. Definitely keep your eyes on this space, because it is exactly where the future is being written.